name's Dr. Ben Shipton. I've been with Primary Health Network going on 11 years, and I went to the Philadelphia College of Osteopathic Medicine in Philadelphia, and then I went from there to a residency program at UPMC in Pittsburgh, and then moved to this area where I grew up. It's kind of a blessing for me to come back to an area and practice where I grew up. A lot of our physicians have that opportunity to come back home after an extended period of medical education. After residency, I joined PHN immediately. Many physicians today find solo practice or opening up a new practice to be cumbersome and cost prohibitive for a number of reasons. One being the simple overhead required to open an office today, and two, liability insurance. Even if one has never been sued, liability insurance can be cost prohibitive, not to mention staff and staffing benefits. So Primary Health Network provides an opportunity for one to be an employed physician and to have operational issues taken care of by the administration of the network so that I can focus on patient care. Primary Health Network takes on patients with a medical access card, whereas other private practices might turn those same patients who are sometimes the sickest of the sick. Those same practitioners might turn those patients away only because they, well, for a number of reasons, but the main reason being financial. They simply cannot make a profit or make their balance sheet by taking care of patients who have Medicaid. Primary Health Network, as a federally qualified health center, not only treats the folks with a medical access card, but also welcomes the 46 million Americans who are without health insurance. We have a sliding fee for those individuals whereby they pay a portion of their office visit on the day of the encounter and then pay what they can as they go along through the subsequent months. Patients with medical assistance in this area would be forced to go to areas that are some 20 or 30 miles away to providers who accept the medical access card. As I mentioned, not every provider does for a variety of reasons, and those people are often the sickest of the sick. They need health care more than a general population because they oftentimes don't take their medicines. They oftentimes fail to show for appointments. They sometimes have socioeconomic problems which prohibit their travel to the office, or they're making appointments and keeping them on a regular basis. So those patients would be greatly hindered if barriers to access in terms of medical care were in place to prevent them from coming in here. Just under this roof, we have family medicine, we have women's health, we have a board-certified urologist, we have an X-ray, full-time X-ray technician, we have full-time lab draw, we have EKG testing, we have ultrasonography at this site. We have nutrition services, we have diabetic education, we have diabetic classes, we have cooking classes here for people with diabetes and for other medical problems. We have a part-time orthopedic clinic at this site, and many of those services can be tailored to the individual site depending upon the needs of the community. So I'm very happy with the services we provide here. We have a full-service pharmacy as well. So our patients are privileged to one-stop shopping under one roof.